Why isn't your insurance company covering obesity medication? Things are finally starting to change. I'm going to give you an update on what's going on just recently, and at the end, talk about what you can do. So for years, insurance companies have had a policy not to cover any medication for weight loss. They've considered it a lifestyle choice and not a legitimate disease. Now things are changing. Over the past couple of years, they've started covering medications for people with obesity who have had heart attacks or strokes in the past, or people with obesity who have obstructive sleep apnea, and they've covered diabetes treatment for quite a while with the GLP-1 medications, but sometimes you have to jump through several hoops to get there. What they haven't considered with their policies is that almost 90% of people with diabetes have obesity. Also, almost 80% of people who have heart attacks or strokes have obesity. These are surprising numbers, and now we have studies that show that actually treating these conditions are leading to less of those downstream side effects. One example is a study with tirzepatide, which is Zepbound. Over a 3-year period, they showed that people with prediabetes taking tirzepatide had a 94% reduction in progression to diabetes. That's almost 100% reduction in progression in the disease state. Another study with 17,000 people for 5 years showed that treating people who have had heart attacks led to 20% less heart attacks and strokes in the future, after adding it to everything that we consider the standard of care right now. That's a huge improvement. And also, the Trump administration announced last year that obesity was one of the biggest health concerns in our nation right now. So with all of this information, we're starting to see a shift. And now Medicare has made an announcement that they're going to start covering obesity medication for people with certain criteria. And we just found out that this last week or two that it's going to start on July 1st. Not only that, but the cost is negotiated down to a reasonable price, and the copay to patients is going to be capped at $50 for most of the insurance plans. That's just for Medicare. They've also made this available to state Medicaid plans that can negotiate the same prices and start the same treatment. This is real, meaningful progress, but it doesn't cover everybody yet with obesity, and it doesn't include every plan. This doesn't include any of the commercial insurance plans that you might get from your employer or buy on the marketplace. So we still have a long ways to go, but it's a huge step forward. So what can you do? You can talk to your employer and tell them that you support coverage for obesity medication with their plan. They have the ability to opt in and provide coverage. We're also working at the Arizona Obesity Organization, writing a white paper analyzing the finances involved in no coverage or coverage. We're actually seeing that patients with obesity and diabetes together cost 3 times more per year for insurance companies, specifically our Arizona Medicaid plan. That's staggering. If we could reduce obesity and diabetes and reduce that cost by 3 times, it's amazing. So think about where this is heading. First of all, I want to emphasize that it's really important for us to eat better, exercise right, and I'm going to have future videos on this. That's key, and our society needs to improve on how healthy we can be. But second, we're going to see much more disease states described by these medical studies as a downstream effect of obesity. We're going to see fatty liver and liver damage. We're going to see more prevention of diabetes. We're going to see prevention of heart attacks and strokes. There's even studies ongoing about cancer prevention, because about 13 cancers are linked to obesity, and numerous other conditions, including mental health, addiction, and other conditions that are related. If we're going to make a change, we need your voice. Sign up for my newsletter. Reply, ask me questions. I'll read every email that comes in and give you a response. I'm going to be sending out a weekly newsletter with the latest updates, the latest on disease states, the latest in medical studies, and the latest in treatment. I hope you'll join me, hope you enjoy my videos, and let's make a difference.